Welcome back to Senior Healthty Care, where you will discover several recommendations for seniors. Today, we provide essential suggestions for seniors that cannot be overlooked. Over 50 butterfly stretch for hips, pelvic floor, and lower back relief. Post-50 women have distinct physiological changes that influence mobility, comfort, and overall health. The hormonal fluctuations of perimenopause and postmenopause, prolonged periods of sedentary behavior, and the progressive alterations in connective tissue flexibility, muscle mass, and bone density associated with biological aging all contribute to these changes. There is increasing interest in accessible, low-impact activities that may be performed at home or in group settings, addressing prevalent concerns such as hip stiffness, lower back pain, pelvic floor dysfunction, and reduced circulation in the lower extremities. The butterfly stretch, Baddha Konasana, or bound angle pose, a fundamental and often taught yoga posture, requires sustained focus. Notwithstanding its status as a basic hip opener, its biomechanics and physiological effects reveal an unexpected array of health advantages for women in midlife and beyond. This study retains empirical data while including terminology, anatomical context, practical examples, and guidelines for safe practice. The butterfly stretch may be contextualized within midlife physiology by examining the changes that transpire post-50, which provide both vulnerabilities and opportunities for targeted movement therapies. The decline of estrogen is the most significant endocrine alteration in several women at this age. Estrogen preserves muscle mass and tone bone mineral density, and the resilience and hydration of ligaments and fascia. With the decline in estrogen levels, connective tissues may exhibit reduced elasticity, muscles may experience less strength and endurance, and bones may undergo demineralization, hence increasing the risk of osteopenia or osteoporosis. The effects of hormones, along with lifestyle variables accumulated over time, such as habitual postures, repetitive movement patterns, and prolonged inactivity prevalent in desk occupations or long-distance driving, result in predicted imbalances. The adductors and hip flexors contract and shorten, whereas the posterior hip muscles, particularly the gluteal complex, weaken or are under-recruited. Such imbalances may induce an anterior pelvic tilt, augmenting lumbar lordosis, and exerting stress on the intervertebral discs and sacroiliac joints. Hormonal and mechanical causes may lead to hypertonicity or weakness of the pelvic floor, the supportive structure of muscles and connective tissues for the bladder, uterus, and rectum, resulting in urine, urgency, stress, incontinence, or pelvic heaviness. The butterfly stretch focuses on inner thigh length, hip external rotation, pelvic alignment, and the soft tissue of the groin and pelvis, offering possible advantages in several areas. Anatomical and biomechanical foundation. To do the butterfly stretch, sit with the soles of your feet together and your knees bent out to the side. This will cause your hips to rotate outward and move apart from each other. The adductor magnus longus and brevis muscles of the inner thigh are the main focus, although the pectineus and gracilis muscles also play a role. When you walk or stand, the adductors generally pull your legs toward the middle and keep your pelvis stable. Muscular stress that lasts for a long time may throw the pelvis out of alignment by putting pressure on the bone connections at the pubis and ischium. Baddha Konasana gently stretches the adductor fibers, which helps the hips rotate and move apart from one another. This helps the muscles in the hip complex stay balanced. This position has biomechanical effects that go beyond the adductors. The piriformis obturator internus and externus gemelli and quadratus femoris are tiny but important hip muscles that gently contract to keep the femur's external rotation within the acetabulum. Light stimulation of these muscles in conjunction with adductor lengthening improves neuromuscular activation and hip mechanics. A lot of deep rotators are connected to the sacrotuberous ligament and pelvic fascia via fascia. Therefore, their tone affects stress on the pelvic floor and sacroiliac joint. The pelvic fascial network connects the adductors to the muscles of the pelvic floor. This means that pressure on the inner thigh may change the tone of the pelvic floor. The adductor longus starts at the pelvic floor and the pubic symphysis. Constricted adductors may change the way the pelvic bones rest and the way the pelvic floor muscles, such as the pubococcygeus and iliococcygeus, work together. Continual adductor strain and pelvic tilt may result in lumbar spine curvature lordosis, hence increasing mechanical stress on the vertebrae and sacroiliac joints. Targeted stretching may reduce tension on the lower back and pelvic spinal discomfort by making the pelvis more stable. It is also important that the groin area be connected to important blood and lymphatic vessels. The femoral triangle is the area on the upper inner thigh that contains the artery vein nerve, multiple lymphatic systems, and superficial inguinal lymph nodes. Muscle stiffness or constriction that lasts for a long time in the adductor compartment may somewhat slow down blood and lymphatic flow because of nearby muscle and fascial structures. The butterfly stretch gently opens up the groin, which may help with arterial supply, venous return, and lymphatic drainage. The anatomical and physiological linkages clarify how a purposeful and regular stretching routine may improve comfort and functionality in women over 50. Problems with the lymphatic and circulatory systems. A thorough examination of health benefits reveals several interrelated topics. Improved circulation in the pelvis and legs, as well as better lymphatic flow, are two of the most noticeable effects. Many women in their 40s and 50s have heavy, chilly feet or minor swelling in their ankles because their blood and lymphatic circulation is not as good as it used to be. The femoral vessels and adductor muscles are adjacent in the medial thigh. Chronic adductor hypertonicity may provide little pressure to these tissues, which might limit blood flow to the distal arteries and veins. The butterfly stretch may help relieve tissue compression and provide room for circulatory systems by stretching the adductors again and over. This does not mean that vascular disease can be cured. It only means that regular exercise might help your legs feel warmer and lighter. The lymphatic system is a network of veins and nodes that moves interstitial fluid and controls immunological function. It needs muscles to contract and move in order to transport lymph fluid. The lymphatic system moves fluid via muscle contractions, changes in breathing pressure, and changes in posture. Blood circulation, on the other hand, depends on a central pump. The inguinal lymph nodes in the groin are responsible for draining lymph from the lower leg and pelvic organs. The butterfly stretch, especially when done with a gentle rhythmic flapping or fluttering of the knees, works as a localized pump by helping lymphatic movement via the inguinal area. Reintroducing regulated repeated movements in this region helps reduce swelling, relieve lymphatic stasis, and improve the body's natural detoxifying processes in those who don't move about much. Regular practice could help the pelvic basin and lower limbs maintain a healthy fluid balance and boost the immune system. The effect of adductor length on pelvic floor tone and bladder performance. The butterfly stretch could make the pelvic floor stronger and help the bladder work better. The pelvic floor includes the pubococcygeus, iliococcygeus, and coccygeus muscles, as well as a complex fascial matrix that holds the pelvic organs in place and regulates pressure in the abdomen. After menopause, women may have urine urgency, stress, incontinence, and a sensation of incomplete bladder emptying. There are a lot of different causes. Kegel exercises, which include voluntary contractions of the pelvic floor muscles, are typically suggested to strengthen a weak pelvic floor. However, their effectiveness also relies on how they interact with nearby tissues and how the pelvic ring is aligned. If the adductors are too tight, they may put stress on the pelvic bone landmarks, which may change the length and tone of the pelvic floor muscles. Maladaptive tension patterns may cause a hypertonic pelvic floor, which can contribute to pelvic discomfort, a need to urinate often, or trouble relaxing when urinating. The butterfly stretch helps the pelvic floor by stretching the inner thigh and letting the pelvis move into a more neutral position. This helps relieve unusual mechanical stress on the pelvic floor. This approach may reduce maladaptive bladder sensory input and improve pelvic organ support, hence relieving nocturia and daytime cravings. The stretch doesn't take the place of focused pelvic floor therapy when it's needed, but it does help make the pelvic area ready for better strengthening or relaxation approaches. Pain in the lower back, stiffness in the hips, and problems with the mechanics. Lower back discomfort and hip stiffness are common in middle age and are typically linked to the relationship between the hip pelvis and spine in an indirect way. Changes in pelvic alignment affect lumbar stresses and spinal mechanics because the pelvis supports the spine. If the adductors are too tight, they could stop the femur from moving within the acetabulum. This might cause a permanent anterior pelvic tilt, which would make lumbar lordosis worse and put pressure on the posterior intervertebral discs and facet joints. Mechanical stressors may cause long-term pain or pain that comes and goes. The butterfly stretch works the adductors and helps the hips rotate outward. Regular exercise may help loosen up the hip joints and bring the pelvis back to a neutral posture. Lessening lumbar strain may improve walking mechanics, make standing more comfortable, and make it easier to do everyday tasks. The stretch corrects an imbalance in the lumbopelvic complex, which might be causing back discomfort instead of merely making the pain go away. Neuropsychosomatic aspects. The butterfly stretch may have effects on the autonomic nervous system and help reduce chronic stress in addition to its mechanical benefits. Deliberate concentrated exercise and diaphragmatic breathing may stimulate the vagus nerve, a key parasympathetic nerve promoting calm, reducing heart rate, and improving digestive function. The butterfly stretch may create a safe neurophysiological environment that lets the body let go of its protective mechanisms and release deeper layers of muscle tension when done with slow, deliberate breaths, especially long, full exhalations and focused awareness on stiff areas. Somatic release helps both the body and the mind feel better. After deliberately practicing the position, several practitioners report less anxiety, pelvic relaxation, and an enhanced ability to identify and release emotions. Even though these feelings are subjective, they fit with somatic treatments and neurophysiology, showing how the nervous system and muscle tone work together. Increased awareness of the pelvis, a place where people hold emotional tension together with light mechanical stimulation from stretching, may improve interoception and the stress response. Good things that happen when you gently decompress your spine and enhance your posture. Pelvic alignment and spinal mechanics improve posture and gently relieve pressure. A solid and balanced pelvis helps the vertebral column stack properly with its natural curves. This makes breathing easier, reduces the amount of muscle effort needed to stay upright, and slows down the natural deterioration of the spine. The butterfly stretch helps the thoracic spine move more freely by relaxing the adductors and putting the pelvis in the right place. It also helps with too much lumbar curvature. When you lean forward at the hips and keep your spine long and straight, your lumbar vertebrae become a little longer. This forward-leaning posture may help relieve strain on the lower back after sitting for a long time. Improved pelvic alignment and frequent spinal stretching may lead to a higher, more balanced standing posture and less slouching, which may make breathing easier and more comfortable. Metabolism, hydration, and movement in the region. A holistic viewpoint indicates that consistent practice of butterfly may improve pelvic vitality, including overall circulation, innervation, and tissue flexibility within the pelvic area. Improved blood flow in the area brings oxygen and nutrients to soft tissues, which helps cells work, repair themselves, and stay strong. Better lymphatic drainage gets rid of metabolic waste and eases congestion in tissues. Fascial tissues need to be hydrated and flexible so that muscles and organs may move around easily. The butterfly posture's gentle, repeated stretching preserves fascial mobility, which improves nerve transmission and mechanical function. When they start this program, many women say they feel less bloated and more comfortable and connected in their lower belly and pelvis. These experience narratives do not supplant clinical studies. Nonetheless, they suggest the pose's potential as a component of a self-care routine that prioritizes physiological function over sickness. Step-by-step rules for safe practices. For these physiological notions to work, you need to use a careful and planned strategy. The goal is to slowly stretch the hips and groin without putting too much strain on the tissues. It's easy to sit down on a sturdy surface using a cushion-folded blanket or yoga block if you need to. Raising the hips a little forward maintains the regular curvature in the lower back and protects it. Dress in a way that lets your hips move freely. When you sit down, keep your spine straight. Bring the soles of your feet together and straighten your knees. Moving the heels closer together makes the outer hips stand out more, while moving them further away from the pelvis gently lengthens the inner thigh. Put your hands on your feet, shins, or thighs to get balance. Instructions for posture. Stand up straight. Breathe in to stretch the spine as if a thread is pulling the top of the head up, and let the shoulders drop. Keep your chin tucked in a bit to keep your neck neutral. Imagine gently stimulating the muscles in your lower abdomen to keep your lumbar spine stable and stop it from bending too far. Unfolding. When you breathe out, let your knees relax and drop to the floor without putting any stress on them. Gravity will help. Instead of tensing up, breathe into your lower belly to let your diaphragm drop and your pelvic floor relax. Change the spacing or supports for the feet based on how they feel without any prejudice. Different ways to engage practitioners may hold a static stretch while breathing deeply for 30 to 90 seconds every repeat, or they can add short, controlled rhythmic movements. A gradual, delicate butterfly flutter of the knees with little movement will help the lymphatic system work better. You should complete 30 to 50 gentle pulses for each set. As another alternative, do 3 to 5 intentional lateral circles with your knees aligned, changing direction to work various tissue bands. If you need to use a metronome or count to keep the beat, take a deep breath in to lengthen your spine, then exhale to bend at the hips, while keeping the natural curve of your lower back for a mild forward hinge. If it's hard to get to the feet, put your hands on the shins or rest a forearm on the thigh to keep the spine stable. Move the pelvis forward and down and bend just enough to make breathing easier. To get your body moving in harmony, focus on calm, diaphragmatic breathing. Inhale to become ready and grow, then exhale to relax and let go. Breathe out longer than you breathe in to relax your nervous system. For instance, breathe in 4 times and out 6 to 8 times. Take a few breaths before each movement to check the pelvis and see how tense it is. Both methods should be done with ease and regulated breathing, and you should stop if you feel a sharp shooting or pinching pain. Accessible and gradual modifications. Numerous accessible modifications enhance flexibility for those with joint sensitivity, limited hip range of motion, or other constraints. Utilize a yoga block, wrapped blanket, or cushion to support each thigh or knee, hence reducing stress and facilitating the extension of adductor fibers without muscular guarding in cases of knee or hip discomfort. The position is more relaxing when performed supine, with the soles of the feet touching and the knees spread apart. Supportive props may be placed under the knees. This reclining position is optimal for soothing the nervous system before sleep, or for those who experience discomfort when sitting. A rope or belt around the foot arches may subtly draw the feet closer, while the practitioner reclines or sits, allowing precise intensity regulation without hip movement. A realistic regimen may consist of 2 to 3 sets of 30-second holds, or a single set of 30 to 90 slow fluttering pulses, executed once or twice daily, according to individual tolerance and time constraints for those with restricted hip mobility. As mobility increases, practitioners may gradually extend hold duration to 3 to 5 minutes or more every session, ensuring pleasant stretching is maintained. Incorporating active strengthening into the butterfly stretch is an additional incremental adaptation. To integrate the enhanced range into active control, do clamshells or band-resisted hip external rotations after a short hold. Stretching and strengthening enhance passive range and functional mobility. Safety and contraindications. A prudent individualized strategy is crucial for safety. Prior to commencing a stretching regimen, especially for those with pre-existing medical conditions, consult a physician, physical therapist, or movement instructor. In the case of an acute groin or inner thigh injury, the butterfly stretch should be avoided or performed with caution. Adherence to a surgeon's rehabilitation protocol is essential after hip, knee, or pelvic surgery to prevent premature stress on the surgical site. Inadequate hip opening may exacerbate sacroiliac joint instability, thus professional assistance is recommended. Intense movements and pronounced forward bending may strain vulnerable bone components in advanced hip osteoporosis. Moderate supported alterations of the posture are preferable. Individuals with a history of venous thromboembolism, including deep vein thrombosis (DVT), should seek medical advice before engaging in any activities that alter venous and lymphatic circulation. Gentle activity may enhance circulation. Nevertheless, previous clotting needs expert evaluation. We must also take into account pregnancy and the postpartum period. Refrain from adopting unpleasant or demanding positions during pregnancy, since hormonal changes relax the pubic symphysis and pelvic ligaments, while the enlarging abdomen influences pelvic mechanics. The supine posture may become uncomfortable during pregnancy. Postpartum sensitivity and diminished pelvic floor function are typical after childbirth, especially after vaginal delivery. A pelvic health physiotherapist should direct a gradual, moderate strategy prior to incorporating more dynamic modifications of the posture. In all cases, monitor sensations. Mild to moderate stretching is okay, but strong radiating or neuropathic pain should prompt cessation and further examination. Acute edema, thoracic pain, unilateral extremity pain accompanied by erythema and hyperthermia or neurological manifestations need immediate medical attention. An integrated curriculum for balanced movement. When integrating the butterfly stretch into a wellness regimen, assess its synergy with other exercises. The stretch is not an independent therapy and does not replace certain treatments when required. This constitutes a segment of a comprehensive program that may additionally encompass posterior chain fortification, gluteal activation exercises, such as bridges, clamshells, and guided deadlifts, cardiovascular activities to enhance systemic circulation, walking, cycling, and swimming, and targeted pelvic floor rehabilitation that instructs on strengthening and relaxation techniques. These substances may enhance mobility in areas with limited tissue and augment strength and endurance in underactive muscles. Women experiencing menopause may benefit from regular mild exercises, such as the butterfly stretch, which enhance circulation, musculoskeletal alignment, and nervous system control without the need for specialized equipment or significant time commitment. Illustrative sequences and methodologies. Here are methods to include the butterfly stretch into your daily routine. These are examples. Requirements and capabilities vary. Commence the morning with 1 minute of diaphragmatic breathing to activate the nervous system. Concentrate on prolonged exhales while maintaining the butterfly position for 2 sets of 45 seconds on a cushion. Perform 2 sets of 10 glute bridges to engage the posterior chain, followed by a 5-minute brisk walk. Midday office exercise 5 minutes. Stand and do a gentle hip hinge and pelvic tilt to alleviate stiffness. Perform 1 set of a 60-second seated butterfly stretch on the floor if there is enough room. If not, sit in a chair and bring the soles of your feet together in a mini approximation, allowing the knees to extend outward for 1 minute, then stand and walk for 2 minutes to restore circulation. Following prolonged sitting, stand and do gentle hip circles to mobilize the pelvis during a brief office intermission, 3 to 5 minutes. Assume a seated position on a chair at work with feet together and knees gently apart to replicate the posture. Engage in hip opening for a duration of 60 seconds. Assume the sitting butterfly position on the floor and do 30 mild knee flutters to stimulate lymphatic circulation, then stand and walk for 2 minutes. Evening restorative sequence 10-15 minutes. Emphasize slow abdominal breathing and pelvic floor relaxation cues while lying with feet together and knees supported by bolsters or folded blankets for 5 to 10 minutes. Perform a brief butterfly forward fold variant 1 to 3 minutes, to alleviate tension in the lower back before going to sleep. Therapeutic integration: employ the butterfly stretch, in conjunction with guided pelvic floor relaxation, biofeedback, and progressive strengthening under the supervision of a pelvic health therapist. The stretch may need 5 to 10 minutes prior to pelvic floor coordination and strength exercises in a standard rehabilitation session. Advancement monitoring and assessment. Advancement is often gradual and incremental. Pain intensity during daily activities: standing, walking, climbing stairs, reported leg heaviness or edema, urinary urgency, or nocturia, and objective assessments such as improved knee-to-floor distance or extended comfortable sitting duration are valuable markers. A fundamental record of practice duration modality, static hold versus fluttering, felt intensity on a 0-10 scale, and symptomatic variations over weeks may assist in identifying patterns and modifying the program. Potential outcome metrics and timelines. Document weekly baseline morning and evening pain levels on a 0-10 scale. Reevaluate after 6 to 8 weeks. Assess leg heaviness and edema using a subjective assessment scale of 0-10 and measure ankle circumference if applicable. Do monthly evaluations. Document nighttime awakenings accompanied by feelings of emptiness and urgency on a daily basis for 1 week, then evaluate after 4 to 8 weeks. Utilize a tape measure or your fingers to assess the distance from the knee to the floor in the butterfly position. Conduct a monthly reassessment. Reevaluate monthly functional activities, including chair rising duration and stair ascent without pain. Some individuals have immediate perceived advantages in warmth or mobility after a single session, whereas more enduring structural and neuromuscular changes need weeks to months of consistent practice. Engaging in 3 to 5 sessions weekly for a duration of 6 to 8 weeks is a pragmatic objective to assess genuine improvement and adjust frequency and intensity as necessary. Frequent mistakes and their resolutions. Numerous challenges emerge when instructing or executing the butterfly stroke. Familiarity with them mitigates danger and enhances reward. Support the lower back. Sit on a small cushion to tilt the pelvis forward and actively elongate the spine to avert discomfort from lumbar compression. Stabilize the spine with little activation of the lower abdominal muscles. Applying pressure to the knees on the floor may lead to ligament overstretching and induce protective guarding. Allow respiration and gravitational force to facilitate your descent and use supports under your thighs as necessary. Breath holding diminishes parasympathetic activation and induces muscular tension. For relaxation, engage in consistent diaphragmatic breathing with prolonged exhales. Disregarding intense or radiating pain, sharp shooting or numb sensations may indicate nerve irritation or other conditions. Cease the activity and seek professional assistance if symptoms continue. Disregarding bilateral equilibrium. Some favor one side. To address lateral discrepancies over time, use subtle corrective cues and asymmetric supports, a more substantial prop, under the tighter knee. Refrain from using knee drop depth as the only indicator of efficacy. Functional ease, improved symptoms, and balanced strength serve as more pertinent long-term metrics. Help and language for teachers and professionals. Language and signaling are very important for teachers who deal with women over 50. Encourage people to use language that isn't prescriptive, such as, "Notice how much you can comfortably open today," and stress how important breathing is. Give them a choice of seats and supports, and don't have them kneel on the floor as a general rule. Encourage them to keep a notebook and keep track of their symptoms to make stretching a part of their health objectives. Oral help. Breathe in and out while extending your spine. Relax your hips. Instead of putting pressure on the knees, think about a gentle opening from the groin. If you feel pain, lower the intensity and focus on breathing into the area for 3 cycles. Use a cushion under the sit bones to help the anterior pelvic tilt and protect the lumbar area. Illustrations use anonymous case studies. A 56-year-old lady with persistent anterior pelvic tilt and periodic low back discomfort Felt better standing after 6 weeks of daily 3-minute butterfly treatments and fortnightly glute activation exercises. She felt less stiff while standing and had fewer interruptions while gardening. A 62-year-old lady with minor nocturia and pelvic heaviness integrated 2 minutes of morning and evening reclining butterfly holds into a complete pelvic health program, supervised by a physiotherapist. She felt less pressure and a lightness in her legs. Objective monitoring showed 1 to 2 gaps at night down from 3. Case 3. A 59-year-old office worker who had ankle pain from extended trips added 30 modest butterfly flutters to her hourly break routine for a week of travel. Her anecdotal report of less swelling and inner thigh discomfort at the conclusion of the day exemplifies a practical and concise use of the strategy. Case 4. A pelvic health therapist determined desensitization with brief supported reclining. Butterfly holds for a 64-year-old patient with chronic pelvic discomfort and hypertonic pelvic floor muscles. She reported enhanced pelvic floor downtraining and less guarding after pelvic exams conducted over many months. Responses vary from person to person, and a multidisciplinary evaluation is typically helpful for complicated problems, limitations, and factors influencing evidence. The anatomical and physiological justification for the butterfly stretch is substantial, and several practitioners indicate subjective benefits, yet there is a scarcity of clinical research about Baddha Konasana in middle-aged women. Research on hip mobility and pain, pelvic floor rehabilitation, lymphatic physiology, and the autonomic consequences of breath movement is more common than randomized controlled trials related to this position. Understanding fascia muscle length tension correlations, lymphatic propulsion processes, and breath movement techniques for autonomic regulation, together with convergent clinical experience, validates its use. As a result, suggestions must be low-risk, possibly advantageous self-care measures that enhance evidence-based medical and rehabilitative treatments. Future research prospects encompass controlled studies, juxtaposing structured butterfly protocols with sham stretching or alternative mobility interventions in peri- and postmenopausal women, evaluations of objective lymphatic or vascular function, pre- and post-intervention, and trials investigating the amalgamation of these protocols with pelvic floor rehabilitation for urinary symptoms. The practice is empirical, yet carefully directed by evidence until such data become accessible. Practical advice for long-term compliance. To keep getting rewards, you need to work hard all the time. Look at these practical ways to improve compliance. Micro-sessions, doing 1 to 3 minutes of practice many times a day, may work with hectic schedules and have benefits. Add the stretch to your everyday routine, such as after coffee, during commercial breaks, and before bed. Use props, cushions, blankets, blocks, and straps make postures easier to do and more likely to be practiced. Group teaching or partner-assisted sessions may help people feel more motivated and supported. Keep an eye on subjective signs like discomfort, urgency, and leg heaviness over a period of weeks to show improvement and keep people interested. To make your exercise more interesting and meet the needs of your tissues, switch between sitting, reclining, and forward folding positions. To make butterfly a part of a healthy routine, combine it with brief walks, breathing exercises, or weight training. Final thoughts and conclusions. In conclusion, the butterfly stretch Baddha Konasana is a simple, low-impact way to help women over 50 with a number of anatomical and physiological problems. The position helps with pelvic alignment, lumbar mechanics, and groin vascular and lymphatic channels by stretching the adductor muscle group and encouraging hip external rotation. Practicing diaphragmatic breathing with mindfulness may activate parasympathetic nerves and reduce patterns of physical tension. With the right changes and precautions, it may be done safely while sitting supported or lying down as part of a regular routine that improves the health and strength of tissues. A few minutes of mild opening every day may improve fluid dynamics, muscle tone, and the connection between the pelvic and lower abdominal areas. It's easy to practice and can be done anywhere. Many women who are going through physiological changes in middle age utilize the butterfly stretch as a helpful, restorative way to feel better, work better, and have a more positive view of becoming older. Like any other self-care routine, the best results come when it is personalized, combined with strength and cardiovascular conditioning when needed and guided by medical or rehabilitative advice as needed. Thank you for watching the video. Please let us know your thoughts and goodbye for now.